Let me sit down with you for a few minutes, because what I'm about to share changed the way I practice medicine, and it changed the way thousands of my patients manage their blood sugar without adding a single new pill to their routine. I want you to imagine something with me. It's 7 in the evening, dinner is finished, the plate is empty, and your body is now facing a decision point, a fork in the road that happens every single time you eat, whether you realize it or not. On one path, your blood sugar spikes upward like a rocket, stays elevated for hours, and slowly, silently, chips away at your blood vessels, your nerves, your eyes, your kidneys, your heart. On the other path, that same meal barely causes a ripple. The glucose rises gently, peaks low, and comes back down quickly, like a calm wave instead of a tidal surge. Same food, same portion, same person. The only difference between those two paths is one simple move that takes less than 10 minutes and costs absolutely nothing. I'm going to tell you exactly what that move is, why it works, what the research actually shows, and how you can start doing it tonight. Literally tonight, after your very next meal. But before I give you the answer, I need you to understand why this matters so much, because once you understand the why, you will never skip the what again. I've spent years in clinical practice watching patients walk in with lab reports in their hands, faces tight with worry, asking me the same question over and over. "Doctor, my sugar is high again. I'm eating better. I'm trying. Why isn't it coming down?" And here's the truth I eventually had to tell them, the truth most people are never told clearly enough. It's not just what you eat. It's what you do in the 60 to 90 minutes after you eat that determines whether that meal becomes fuel for your body or fuel for disease. Let's talk about what actually happens inside you after a meal, because this is where the real story begins. When you eat carbohydrates, rice, bread, pasta, fruit, even so-called healthy whole grains, your digestive system breaks them down into glucose. That glucose enters your bloodstream, and your blood sugar level begins to climb. In a healthy, well-regulated body, your pancreas releases insulin, a hormone whose job is to unlock your muscle cells and let that glucose in, where it gets used for energy or stored for later. This is a beautiful, elegant system when it's working properly. But here's the problem. For most people living modern, sedentary lives, sitting after meals, lying down after meals, scrolling on the couch after meals, that glucose has nowhere efficient to go. The muscles are idle. They're not asking for fuel. So the glucose lingers in the bloodstream longer than it should. Blood sugar spikes higher, stays elevated longer, and your pancreas has to work overtime pumping out more and more insulin to try to bring it down. Do this meal after meal, day after day, year after year, and you are looking at the slow buildup toward insulin resistance, prediabetes, type 2 diabetes, weight gain around the belly, fatty liver, and a cascade of cardiovascular risk that creeps up on people silently until one day the numbers on the lab report can no longer be ignored. Now, here is the beautiful part. Here is the one simple move I promised you. It is walking. Not running, not an intense gym session, not some complicated regimen, just walking. Specifically, walking after your meals, for as little as 10 to 15 minutes, at a light to moderate pace. I know what some of you are thinking right now. "Doctor, that sounds too simple, too basic. I've heard walk more my whole life, and it never felt like it was doing anything specific." I understand that skepticism, and honestly, I used to feel the same way until I actually looked closely at the research and started testing it with my own patients using continuous glucose monitors. What I found changed the way I counsel every single person who sits across from me. Studies looking at post-meal walking have shown reductions in post-meal blood sugar spikes that in some trials reached numbers as high as 50% or more, compared to remaining sedentary after the same meal. Some research has shown reductions in that range specifically when a short walk is taken within 30 minutes of finishing eating rather than waiting an hour or two. The timing matters. The muscles need to be activated while that glucose wave is still rising, so that instead of building up unchecked in your bloodstream, it gets pulled directly into your muscle tissue and used as immediate fuel. Think about what your muscles are during a walk. They are glucose-hungry machines. The moment you start moving your legs, your muscle cells increase their uptake of glucose through a pathway that doesn't even require much insulin at all. It's called insulin-independent glucose uptake, and it happens because physical movement itself triggers the transport of glucose into the muscle cell through a transporter called GLUT4. In simple terms, when your legs are moving, your muscles open a side door and pull sugar out of your blood without needing your pancreas to shout as loudly through insulin. This means less strain on your pancreas, lower circulating insulin, lower circulating glucose, and over time, better insulin sensitivity throughout your entire body. I want you to picture your bloodstream like a river and glucose like a rising water level after a storm. If that water just sits there with nowhere to drain, it floods the banks. That's the tissue damage, the inflammation, the long-term complications. But if you open the floodgates by moving your muscles, that water drains away quickly, safely, and the river returns to its normal calm level. That's what a short walk does after a meal. It opens the floodgates. Now let me address something important, because I don't want you thinking this only matters if you already have diabetes. This matters for every single person listening to me right now, whether your blood sugar is perfectly normal, whether you're pre-diabetic, whether you're managing type 2 diabetes, or even if you're just someone trying to lose stubborn belly fat. That won't budge, no matter what diet you try. Repeated blood sugar spikes, even in people without diabetes, are linked to increased fat storage, increased hunger and cravings a few hours later, energy crashes, brain fog, and accelerated aging of blood vessels. Flattening those spikes isn't just a diabetes management tool. It's one of the most powerful, underused longevity tools available to anyone, for free, starting today. Let me walk you through exactly how to do this properly, because the way you do it matters just as much as the fact that you're doing it at all. First, timing. The single most important factor is starting your walk soon after you finish eating, ideally within the first 15 to 30 minutes. This is the window where your blood glucose is beginning its climb. If you wait 2 or 3 hours, the spike has often already happened and started to come back down on its own, and you lose much of the benefit. So don't finish dinner, sit down to watch a show for 2 hours, and then decide to take your walk. The magic is in that early window. Second, duration. You do not need to walk for an hour. You do not need 10,000 steps in one session. 10 minutes is enough to create a measurable difference. 15 minutes is even better. If you can stretch to 20, wonderful. But I don't want anyone thinking they need to carve out a massive block of time, because that's exactly the kind of expectation that makes people give up before they even start. 10 minutes. That's it. Everyone has 10 minutes. Third, intensity. This is not about speed walking until you're breathless. A light to moderate pace is ideal. A pace where you could still hold a conversation, but you're clearly moving, clearly engaging your leg muscles, clearly getting your heart rate slightly elevated above resting. Think of it as a purposeful stroll, not a casual meander, and not a sprint. Fourth, consistency. This is where the real transformation happens, not from one walk, but from making this a habit after every major meal, or at the very least after your largest meal of the day, which for most people is dinner. The compounding effect of doing this after breakfast, lunch, and dinner, day after day, is what separates someone who sees their fasting blood sugar and HbA1c improve over 3 months from someone who tries it once and wonders why nothing changed. Now, I want to talk to those of you who are thinking, "Doctor, I have joint pain, I have mobility issues, I can't easily go outside and walk after every meal." I hear you, and I want you to know this principle isn't rigid. The core mechanism is muscle contraction pulling glucose out of the bloodstream. If walking outside isn't accessible to you, marching in place near your kitchen counter, doing gentle body weight movements like standing calf raises, doing a few minutes of light housework that keeps you on your feet and moving, or even walking slow laps around your living room can activate that same muscle glucose pathway. The exact form matters less than the principle. Move your major muscle groups gently but consistently in that window right after eating. I also want to address the people who tell me, "But doctor, I work a desk job. I can't just get up and walk around the office right after lunch." Here's what I tell my patients in that exact situation. Even a 5-minute walk to a water cooler and back, done 2 or 3 times in that post-lunch hour, adds up. Taking the stairs instead of the elevator right after eating, parking farther from the office and taking a short walk in during your lunch break instead of eating at your desk and going straight back to sitting. These small windows of movement stacked together create a meaningful metabolic effect, even if you can't manage one continuous 15-minute walk. Let me also clear up a common misconception, because I get this question constantly. People ask me, if walking after meals is so powerful, why hasn't anyone told me this before? Why did my doctor just hand me a prescription instead of mentioning this? And I want to be honest with you about this, because I think you deserve honesty. In a typical medical visit, doctors have an average of just a few minutes with each patient. There's often barely enough time to review lab results, adjust medication dosages, and address urgent concerns, let alone sit down and explain the physiology of post-meal glucose transport and walk someone through building a sustainable habit. It's not that this information is secret or suppressed, it's that our healthcare systems are built for speed, not for depth, and lifestyle counseling often gets squeezed out. That's part of why I wanted to sit down and talk to you like this today, without a 10-minute clock running, so you can actually understand the why behind the advice instead of just being handed a pamphlet. I also want to gently push back on something I hear a lot, which is people assuming that medication and this kind of lifestyle strategy are somehow in competition with each other, as if you have to choose one or the other. That is not how I think about this, and it's not how I counsel my patients. If you are on medication for blood sugar management, please continue taking it exactly as prescribed, and please continue working closely with your physician. What I'm describing to you today is not a replacement for medical treatment. It is a powerful complement to it. Many of my patients who combine their prescribed treatment plan with consistent post-meal walking see improvements that allow their doctors, over time and under proper medical supervision, to reconsider dosages. But that decision should always be made in partnership with your treating physician based on your actual lab work, never on your own based on a video you watched online. Now let's talk about the bigger picture, because blood sugar control isn't just about avoiding a diabetes diagnosis. I want you to think about your blood vessels as delicate, intricate highways running throughout your entire body, through your eyes, your kidneys, your heart, your brain, your fingertips, your toes. Every time blood sugar spikes sharply and stays elevated, it's like sending a fleet of trucks that are slightly too large down those highways, again and again, causing microscopic wear and tear to the highway walls. Over months and years, this repeated stress contributes to the thickening and stiffening of blood vessels, inflammation, and oxidative stress, the underlying mechanisms behind so many of the conditions we fear most: heart disease, stroke, vision loss, kidney disease, nerve damage, and even slower wound healing. When you flatten those glucose spikes through something as simple as a post-meal walk, you are, quite literally, reducing the number of times per day those highways get pounded by an oversized truck. You are protecting the very infrastructure that keeps every organ in your body functioning. This is why I consider this such an enormous piece of preventive medicine, even though it looks, on the surface, like something almost too modest to matter. I want to share a bit of what I've personally observed, because numbers on a page are one thing, but watching it happen in real people is what truly convinced me. I've had patients wear continuous glucose monitors, NET small sensors that track blood sugar throughout the day, and we've run simple side-by-side comparisons. One day, they eat a meal and remain seated afterward, watching television or working at a desk. The next day, they eat the exact same meal, and instead of sitting, they take a 15-minute walk starting within 10 minutes of finishing their food. The glucose curves on those 2 days, sitting right next to each other on the screen, tell a story more convincing than anything I could say. On the sedentary day, the line shoots upward into a sharp, tall peak and lingers there. On the walking day, the line rises gently, peaks noticeably lower, and comes back down to baseline much faster. Same person, same meal, same portion size. The only variable that changed was those 15 minutes of walking. I remember one patient in particular, and I won't share identifying details, of course, but the pattern of her journey is something I've now seen repeated in dozens of people. She came to me frustrated because her fasting blood sugar readings kept creeping upward despite what she described as eating clean. When we looked closer at her daily routine, I realized the missing piece wasn't her diet at all. It was that she worked from home, ate all 3 meals at her desk, and then simply continued sitting and working for hours afterward. We didn't change a single thing about her diet initially. We just added a 10-minute walk after each meal, using a simple loop around her block or, on bad weather days, walking up and down her stairwell. Within a few months, her fasting glucose numbers had improved meaningfully, and she told me she also noticed she wasn't hit with that heavy, sluggish afternoon crash she used to blame on just getting older. That crash, by the way, is often a direct symptom of a glucose spike followed by a steep glucose drop, the classic blood sugar roller coaster that leaves you reaching for coffee or sugary snacks just to function through the afternoon. This brings me to another point I really want you to internalize. Flattening your blood sugar spikes doesn't just protect your long-term health, it changes how you feel today, this afternoon, tonight. Steadier blood sugar means steadier energy. It means fewer intense cravings a few hours after eating, because those cravings are often your body's panicked response to a glucose crash, begging for quick sugar to bring levels back up. It means better mood stability, because your brain runs on glucose, and wild swings in blood sugar are strongly linked to irritability, anxiety spikes, and difficulty concentrating. It means better sleep quality, particularly if your last big spike of the day happens right before bed and disrupts your body's natural overnight hormone regulation. One simple habit, layered onto every meal, touching nearly every system in your body. Let's talk about a few more practical details, because I want this to be something you can actually implement, starting with your very next meal, not just something that sounds inspiring for 5 minutes and then gets forgotten. If you're someone who eats dinner and then immediately feels too full or sluggish to move, I want you to reframe that feeling. That heaviness, that sluggishness, is very often a sign of a glucose spike beginning, and gentle movement is precisely the antidote to that feeling, not something that will make it worse. Start slow. Walk at whatever pace feels comfortable in that moment. You will often find that within a few minutes, the sluggishness lifts rather than intensifies, because you're actively helping your body process that meal instead of letting the glucose and the digestive workload sit heavily and unaddressed. If you live somewhere with harsh weather, or if it's simply dark and unsafe to walk outside after dinner, don't let that become the reason you skip this altogether. Walking indoors works just as well. Pace your living room. Walk hallway laps in your apartment building. Use a small treadmill if you have one, even at the lowest incline and speed. The glucose uptake mechanism in your muscles doesn't care whether you're outside under the sky or walking circles around your dining table. It only cares that your muscles are contracting rhythmically for those 10 to 15 minutes. If you have family members, a partner, or children at home, I'd encourage you to make this a shared ritual rather than a solo chore. Some of my patients tell me that turning this into a family after-dinner walk has become one of their favorite parts of the day. A chance to talk, decompress, and connect, all while quietly protecting everyone's metabolic health at the same time. Habits that come attached to something enjoyable are habits that survive long term, and this is a rare case where the healthy choice and the pleasant choice can be exactly the same action. I also want to speak directly to caregivers and family members of people managing diabetes, because I know many of you are listening on behalf of a parent, a spouse, or a loved one. This is one of the gentlest, safest, most accessible interventions you can encourage, especially for older adults who may feel intimidated by the idea of exercise as a big, structured, gym-based activity. Framing it simply as, "Let's take a short walk together after dinner," removes the intimidation factor and turns it into something social, low pressure, and sustainable, rather than one more difficult task added to an already overwhelming health routine. Now, I do want to be balanced and thorough with you, because I never want to oversell a single intervention as if it's the only thing that matters. Post-meal walking is extraordinarily powerful, but it works best as one pillar among several. Pairing it with mindful attention to the order in which you eat your food, vegetables and protein before refined carbohydrates, for instance, can further blunt glucose spikes. Adequate sleep matters enormously, because poor sleep is independently linked to worsened insulin sensitivity the very next day. Managing chronic stress matters too, because cortisol, your body's primary stress hormone, directly raises blood sugar levels, meaning a stressful lifestyle can undermine even a perfect diet and exercise routine. Staying adequately hydrated helps your kidneys assist in regulating blood glucose more efficiently. I mention all of this not to overwhelm you with a giant list, but so you understand that the post-meal walk is a foundation you can build on, not the only brick in the wall. But if I had to choose just one single habit to recommend to every patient who walks through my door concerned about their blood sugar, one thing that is free, requires no equipment, no gym membership, no special skill, and can be started literally tonight after dinner, it would be this: get up and walk for 10 to 15 minutes within the first half hour after you finish eating. That's it. That's the whole instruction. No complicated formula, no expensive supplement, no restrictive diet you'll abandon in 3 weeks out of sheer exhaustion. Just movement, timed intentionally, right when your body needs it most. I want you to think about how many meals you eat in a week. If you eat 3 meals a day, that's 21 opportunities every single week to either let glucose spike unchecked or to gently guide it back down through your own 2 feet. 21 chances a week to protect your blood vessels, your pancreas, your energy levels, your mood, and your long-term future. You don't need to hit all 21 perfectly. Even hitting 7 or 8 of them, say a walk after your largest meal each day, creates a compounding benefit over weeks and months that shows up not just in how you feel, but in the actual numbers on your next lab report. I also want to leave you with this thought, because I think it matters more than any statistic I've shared today. So much of modern medicine has trained us to look for the complicated solution, the new drug, the expensive test, the elaborate diet plan with dozens of rules to memorize. And there is absolutely a place for those things. I prescribe medication every single day, and I believe deeply in evidence-based treatment. But sometimes, the most powerful tool available to protect your health has been sitting right there the entire time, disguised as something too simple to matter. Walking after a meal feels almost too basic to be medicine, but physiology doesn't care about how impressive an intervention sounds. It cares about what actually happens inside your bloodstream, inside your muscles, inside your pancreas, minute by minute. And what actually happens, backed by real research and reflected again and again in my own patients' glucose readings, is that this one simple move genuinely, measurably drops the blood sugar spike that follows a meal, sometimes dramatically. So here is what I want you to do. Tonight, after you finish your dinner, I don't want you to reach for the remote control first. I want you to stand up, put on a pair of shoes, and walk around your block, around your living room, up and down your hallway. It doesn't matter where, only that you move your legs rhythmically for 10 to 15 minutes, starting within that first half hour. Notice how you feel afterward. Notice if that heavy, sluggish, bloated feeling lifts. Notice your energy an hour later. And if you have the ability to check, notice your blood sugar reading before you go to bed compared to nights when you didn't walk. Let your own body show you the proof, because nothing I say here will convince you as thoroughly as your own experience will. I've given you the science. I've given you the mechanism. I've given you the exact timing, the exact duration, the exact intensity, and I've given you real ways to adapt this whether you're stuck at a desk job, dealing with joint pain, facing bad weather, or simply someone who has never thought of themselves as a walker. There is no excuse left standing between you and trying this starting tonight. This is medicine you already own. You don't need a prescription for it. You don't need insurance approval. You don't need to wait for your next appointment. You just need to stand up after your next meal and start walking. I care deeply about every single person who takes the time to sit and listen to something like this, because I know that behind every question about blood sugar is often a deeper worry, a fear of complications, a fear of becoming dependent on more and more medication, a fear of not being around for the people you love because of a slow, silent condition that crept up over years of well-meaning but incomplete advice. I want you to walk away from this not with fear, but with a genuine sense of empowerment, because this is one of those rare moments in medicine where the most effective advice is also the most accessible advice, available to nearly everyone, regardless of income, regardless of where you live, regardless of your medical history. Take this seriously, not as a passing tip you'll forget by tomorrow, but as a new rule for how you live after every meal from today onward. Your pancreas, your blood vessels, your energy levels, and your future self will all thank you for something as unassuming as 15 minutes on your own 2 feet. If this helped you understand your body a little better today, I want you to do 2 things for me before you go. Hit that subscribe button because I share information exactly like this regularly, breaking down real medical science into practical steps you can use immediately without the jargon and without the fear-mongering. And second, leave a comment below and let me know. Are you going to try this after your very next meal? Tell me where you're walking from. Tell me what condition or concern brought you here today. And if you already track your blood sugar, come back and tell me what you notice after your first week of doing this consistently. I read these comments, and hearing your results is genuinely one of the most rewarding parts of doing this work. So go on, take that walk tonight, and I'll see you in the next one.